So for my final project, I will be discussing cerebral palsy, also known as CP. And cerebral palsy is not just one, but a group of disorders that are caused by abnormal brain development during birth. And symptoms of cerebral palsy often occur as uncontrolled body movements, visual impairment, balance issues, and other things relating around mobility that you can't exactly control when you do have CP. And within this PowerPoint, we're going to be talking about the 4 different types of CP that are often diagnosed by doctors. Although CP is diagnosed around the ages of usually 2 or later, about 60 to 75% of CP cases are due to prenatal injury, which is meaning a traumatic injury that occurred within the womb sometime before giving birth. So the first type of CP we're going to be discussing is spastic, and this is the most common type of CP, and it's caused due to an injury in the cerebral cortex, which is the result into cerebral palsy, obviously. And spastic refers to muscular spasms and hypertonia, and if you refer back to our anatomical terms, hyper meaning above, tonia meaning muscle tone, so this means you have a high muscle tone. And this is often, spastic CP is often characterized by bilateral or unilateral. Bilateral meaning both sides of the body are affected, or unilateral meaning one side of the body is affected. And it's often characterized in 3 different types of spastic CP. The first one is hemiplegia. This meaning that hemi meaning half, plegia meaning stroke. This means that half of the body is paralyzed. And in cases like this, the other half that is not experiencing plegia is often at 100% function. So if it's your left side experiencing plegia, your right side most often has 100% mobility. The second type we're going to be talking about is diplegia, di meaning 2, plegia meaning stroke again. This type of CP is either both of your legs are paralyzed or both of your arms are paralyzed. And like I said, within cases like these, not oftentimes do the opposite limbs have 100% mobility. It's usually about 60%. And the final and last type of spastic CP we're going to be discussing is quadriplegia. Quadra meaning 4, plegia meaning stroke again. This is paralyzation of all 4 limbs, both arms and both legs. And if you'll look at this chart referring back to the spinal nerves that we have discussed within this class, T1 through T4 is often the nerves that are affected by quadriplegia, and that's within the thoracic vertebrae. And this area often controls hand, arm, and leg function, so an injury to this area would explain why quadriplegia would occur. The second type of CP we're going to be discussing is ataxic CP. Ataxia means the loss of full control of the body movements, and this occurs from damage to the cerebellum. And the cerebellum is responsible for coordination in different types of motor function. And if you'll look on this chart, the cerebellum is located at the bottom of the brain, close to the spinal cord, so you can see why most of the movements within the cerebellum control the leg and arm function. The third type of CP we're going to be discussing is dyskinetic. Dyskinetic CP is caused by damage to the basal ganglia. Basal ganglia is responsible for different types of smooth movement, so when diagnosed with this type of CP, it's often hard for people to easily move their limbs, and they struggle, and this can cause different types of repetitive twitching and muscular spasms and other types of things that wouldn't allow your body to move as smoothly as it should when not having dyskinetic CP. If you look on this chart again, the basal ganglia is located right above the thalamus. And the last type of CP we're going to be talking about is a mixed cerebral palsy, and this one is the most least common that's diagnosed from doctors, and this is just because these are different conditions of cerebral palsy when you have multiple areas of the brain that has been affected by some type of injury. This is diagnosed when doctors often aren't sure what area exactly have been affected, but your body is experiencing different types of CP. And this will allow like a more open space when cerebral palsy is just now becoming noticeable. So this will allow an open space for doctors to diagnose it for you. And that is